Now let's switch gears and talk about Shoe for Africa and your work with this great charity, if that's all right.
Yeah, it is. Since I've lived here in New York the last 5-6 years, I've become a much more active recreational runner, and I run here in Central Park. And through that running in Central Park, I met up with a man who started an organization about 13 years ago. He's an ex-professional runner who coaches people here in New York, but has a love and a commitment to Kenya that has manifested itself into an action program that I've never come across the likes before, in which he's inspiring and empowering women through the sport of running in Africa by bringing used shoes over and giving them the opportunity to run. And the shoes really just kind of a foundation for what the work really is, which is about AIDS education, health education, empowerment of women, and that's the organization. So on traveling around the world with my family, we took a year off, and our whole family, we traveled around the world for a year. One of the places we stopped was in Africa, and we went to a Shoe for Africa event. And that really just cemented it to me that this is really where I can see myself spending some years of my charitable efforts in helping. So that's what I'm doing, and I was able to kind of kick it off this year by telling the folks at ER that I was happy to come back and do an episode, but don't pay me. Just, you guys need to contribute to Shoe for Africa, because for the first time in 15 years, we actually are fundraising, and we're fundraising for a very specific reason, which is we're building the largest children's hospital in Africa. So this is a 250-bed children's hospital in northwestern Kenya, where kind of the running capital of Africa is, where a lot of our ambassadors who work with our organization live. And we're tremendously excited about it. We basically, can come in and build this hospital, equip it, and give it as a gift to the Health Ministry of Kenya, and they will run this hospital. There are no public children's hospitals in Kenya, so it's a big first.
So would you say that's what inspired Shoe for Africa to embark upon the mission of building this greatly needed hospital?
Well, it was coincidental with everything. I mean, it really, it was a time, last year we were going to do an event in Kenya, and the violence, the post-election violence erupted in Kenya last year, and we couldn't continue with some of our running races. So we changed our races to peace races as opposed to kind of health and education races. And we brought together children from the different tribes to run together, and as an example of how peacefully together, these cultures can work together. And we're very successful and got a lot of great press in Kenya about it. And so the Kenyan government said, if you guys can do that, you guys should come into this. We have this big plan of building this hospital. Can you help us with it? And so that's really what inspired it. And it was just a great coincidence because to meet with the hospital in August, I was there in August in Kenya at the hospital talking to the directors there, and they were so excited about the fact that Dr. Greene was coming back to life to help them build a hospital.
That's pretty neat.
Yeah. So, it's like those things, when things are happening kind of easily and fluidly in your life, you're doing the right thing. So that's what it feels like here.
Now, could you please describe for us what an average Kenyan or African hospital is like?
Well, that's kind of the tragic thing in Africa is that there is, it's hard for us to relate because we can't imagine living in a place where if you were very sick, first of all, children are second, or kind of third on the tier, because if basically in a family of 5 or 6 children, if the child gets sick, it's more important that the parent is taken care of because they need to take care of the family. So children's health is way down on the priority list. And then when they do get into a hospital, if they are lucky enough to, it's two mothers and 2 children per bed in a hospital with very little resources to service them. There's just such a tremendous need. And 80% of the children in Africa who die without ever seeing a healthcare provider. It's just unimaginable.
Unbelievable.
Yeah, so by building a center, pediatric center, which is what this will be, this will also have a tremendous outreach because it'll be training doctors and nurses that can not only work in that hospital, but then we'll also be able to take that expertise and go out to the smaller clinics and implement the most basic health requirements that are needed. And they're simple things like vitamin A and ways to deal with waterborne bacteria. You know, a lot of these kids are just dying of diarrhea, basically.
So this hospital would be like a general hospital, public general hospital. It wouldn't specialize in helping patients with certain diseases.
Exactly. What we have here is the Moy Hospital, which exists, and it's a teaching hospital. And basically, what we're giving them is an addition. They right now have one room for their pediatric ward, and within that one room, you've got oncology in the corner and infectious disease in the other corner, and all these different modes of pediatric healthcare, and they need space. They need rooms. They need operating theaters. They need MRIs, and they need the space. We're giving them additions. So the passion is there, the desire. We're giving them the ability to also retain doctors and nurses because that's part of the tragedy of Africa is if you train somebody, they go somewhere else to work where there's opportunity. So we're creating opportunities for them to keep.
You're creating Kenya's own county general hospital.
In a sense, yeah.
And I was wondering if we could also talk about some more about the peace races. I believe the project you were referring to earlier was part of the Kibera project, correct?
Well, that was exactly right. I mean, in Kibera, which is it's a slum in Nairobi. It's actually the largest slum in Africa. It's the second largest slum in the world. It's 1.2 million people living in a space the size of Central Park with no running water. So what you're talking about is rivers of sewage basically running through this slum. But what it also is it's 7 different little villages within there. And during the violence, the post-election violence, a lot of Kibera was destroyed, burned, and violence that happened there. So as a result of wanting to have a health impact in Kibera, because that's really what our focus is on, because we had collected 10,000 shoes at the New York City Marathon that year and had them shipped over, is we wanted to give those shoes out for health reasons, and we were able to turn that into a celebration of peace, actually, because it had been a year, and so we had the women of Kibera come together for a run of peace. So 5,000 women came, put on their yellow Run for Peace shirts, and ran through the slum of Kibera, creating this huge yellow river of peaceful women running, and then back, and then we were able to give out shoes and have a big soccer match and celebration. So it was the largest gathering of women, certainly in the slum, if not that part of Africa.